Hello student, in this video lecture we are going to discuss about antipsychotic drugs. These drugs are also known as major tranquilizer drugs. These drugs may also known as the D2 blocker or neuroleptic drugs. These are also known as D2 blocker and neuroleptic drugs. Neuroleptic drugs used in the client with psychotic symptoms. Antipsychotic drugs, it also called major tranquilizers. These are the drugs that are mainly used for the treatment of major psychosis like schizophrenia, mania, delirium, dementia, etc. These drugs are classified into few categories. These are basically classified into two categories. One is known as the uh, it, traditional drugs and atypical newer drugs. इनको हम क्या बोलते हैं? दूसरा newer drugs. Traditional drugs and newer drugs. Traditional drugs are further classified into these two categories. In these, the group of drugs are considered such as holoperidol, chlorpromazine, dorfiridone, etc. These are called the traditional drugs, and newer drugs. Here we conclude the clonazepam, risperidone, loxapine. These are the newer drugs. Here are some facts regarding the antipsychotic drugs. The chlorpromazine is the first discovered antipsychotic drug. It is the first discovered antipsychotic drug. ठीक है. And the holoperidol is the having the maximum EPS, extrapyramidal symptoms with the holoperidol is maximum. Those patients are having getting the treatment by holoperidol are showing the maximum possible extrapyramidal symptoms. One drug is antipsychotic olanzapine, that is maximum weight gain. With that, patient may gain the maximum weight gain. Olanzapine is also a newer drug or a typical antipsychotic drug, and most common effective drug is clonazepam with minimum side effects. It having the very effective drug with the minimum side effect, minimum EPS, ठीक है, but sometime it may cause the granulocytopenia, decrease number of TLC count. So these are some facts about the antipsychotic drug. Next, these drugs are indicated in psychosis, schizophrenia, depressive with psychotic features, organic brain syndrome, OCD, suicidal behavior risk. But here you must note that patient those are having the risk of suicide, these drugs are not to be given to them patient. ठीक है. नेक्स्ट आता है फार्माकोडायनेमिक्स means what drug does in our body, means what is the mechanism of action of these drugs. These drugs, as previously I described, that these drugs also known as the D2 blocker. That means they inhibit the dopamine, neurotransmitter dopamine in the limbic system. They decrease the level of dopamine by blocking the D2 receptors and decrease the level of dopamine. Next one is side effect of these drugs include polyuria, thirst, diarrhea, convulsion, coma, hypothyroidism, hyperglycemia. These are the side effect of these drugs. You must list it out. Sometime examiner ask you in the objective type questions what are giving these all are, and ask the most common side effect of These drug is coma and convulsion. Most common side effect हैं. Next one is what is the pharmacokinetics, how these drugs are absorbed and excreted through the body. These drugs are very well absorbed by the oral, metabolized in liver, cross the placental barrier, excreted through sweat, saliva, urine, breast milk. ठीक है, it is the pharmacokinetics of antipsychotic drugs. These drugs are contraindicated in CNS depression, risk of suicide, glaucoma patient, those are having the glaucoma, myocardial infarction, heart diseases and respiratory distress. इन लोगों को ये ड्रग्स नहीं दी जानी चाहिए. These drugs are interact with the antacid prohibited. इनके साथ हम ये ड्रग का यूज़ नहीं करेंगे. एंटासिड के साथ, एल्कोहल के साथ, एंटी हिस्टामिनिक ड्रग्स, एंटी पार्किंसन डिजीज ड्रग्स एंड एंटी डिप्रेसिव ड्रग्स. नेक्स्ट वन आता है व्हाट आर द नर्सिंग रिस्पॉन्सिबिलिटी इज़ वेरी मोस्ट इम्पोर्टेंट पार्ट ऑफ आवर टॉपिक, दैट इज़ नर्सिंग रिस्पॉन्सिबिलिटी. बिफोर गिविंग द ड्रग्स मस्ट बी असेस द RBC एंड WBC लेवल. जब ये ट्रीटमेंट प्रेस्क्राइब किया जाता है तो आपको RBC और WBC का लेवल पता करना है. असेस द सुसाइडल टेंडेंसी इन पेशेंट. डू नॉट गिव एंटासिड within 1 hour of giving these drugs. Monitor orthostatic hypotension in the patients. Educate the patient regarding drug takes a long time for action. Maintain adequate salt intake. Avoid excessive amount of coffee, tea, alcohol. Avoid drinking. Avoid driving and other hazardous activity when you are taking these drugs. It's all about the antipsychotic drug. If you have any doubt, you can ask me. Thank you, student. Thank you very much.